All right, so look at another surgery that can be done to women. Here we are just trying to look at it brief. So this is what is now the uterine artery ligation. Uterine artery ligation. Right. So can you see the uterine artery is this artery that goes here, and the artery is supplying what? The uterus all along. All right. So you said that it's a surgical technique. It's used to what? Control severe uterine bleeding. Of course, if you are bleeding from the uterus, the blood source is from the uterine artery. You understand? So can you see ligation? They are trying to tie something around it, shut it up. All right. So it's most commonly in cases of postpartum hemorrhage. So the mother gave birth and she's bleeding so much. The source of blood is uterine artery, of course. Or you want to manage gynecological conditions like fibroids. So what is this uterine artery ligation? It's just a procedure where uterine arteries are surgically tied up. Let me look at another picture. See, I'll tie this uterine artery. Blood is no longer passing. There's no bleeding going on, and also there's no blood reaching the uterus. I'm starving the whole thing, So goal is to control bleeding while preserving uterus and fertility. Common use is what? To control maybe bleeding after giving birth, symptomatic uterine fibroids, uterine arteriovenous malformations, all right, as part of cancer surgery. Okay, so how is it performed? It's usually via laparotomy. They open your tummy below, they just cut it below. Technique: the uterine artery is identified where it crosses the uterus in the broad ligament. An absorbable suture is passed through an avascular area of the broad ligament and tied around the artery and vein. Bilateral ligation is typically performed for maximum effect. They tie this side, they tie this side. It's two. So you tie here too. Absorbable sutures, that will tell you that maybe after some time the suture can be absorbed in the body. That's it. They don't need to open you again to free it, right? Of course, after some time the bleeding should stop, then it goes up, then normal life continues. Benefits: it preserves uterus and fertility. It's effective in controlling bleeding in over 90% of cases. Can be performed quickly, all right? It's less invasive than hysterectomy. Risks and complications: may not be effective in cases of abnormal placentation. Potential injury to nearby structures, requires surgical experts. Contraindicated in patients with coagulopathies or maybe an active infections, or you have some unstable cardiovascular status.